Hi everyone, Dr. Chiam here from Ensoul Medical. Today we'd like to talk a little bit more about a condition that we see relatively commonly here in the clinic, and that's dark circles. And a lot of patients come to us for dark circle treatment, having read maybe on the internet or on some clinic websites that I like to do a filler for my dark circles. But very often we need to perform a good assessment of the patient's eyes first before we embark on a treatment protocol. And the purpose of this video is to help you understand the different aspects of dark circle treatment, eye beauty, as well as telling you a little bit more about the options that are available in the market to treat your dark circles and to make you look brighter as well as more energetic. Okay, so we have Yuki here who is going to help me illustrate a little bit about how I assess the eye. So when we look at a patient with dark circle problems, you notice that Yuki does have a little bit of dark circles. There are a few reasons why you develop dark circles, and some of it is hereditary. So in a patient who's, for example, got very high cheekbones and very prominent brows, the bones tend to cast a little bit of a shadow, so there is a little bit of a shadowing effect in that area, so it's not totally because the skin is dark. There is also a role that facial aging plays in the formation of dark circles. If we start to have loss of bone and loss of mid-face volume, you tend to see the junction between the lower eyelid as well as the cheek more prominently. So this is what we know as the lid-cheek junction. So you can see that here in Yuki is rather prominent. So this gives the look of darker area here. So this area would be actually quite well treated with a dermal filler because she has lost a little bit of volume in this area. And so a little bit of a dermal filler would be able to improve the appearance of the dark circles, okay, over there, okay. But if you look at the dark circles, it's important to look beyond the volume of the face. You also have to look at the skin quality of the under eye area. That's actually quite an important aspect of treating dark circles. There are many conditions that actually would predispose to a darker area under the skin. So even medical conditions such as asthma, such as allergic rhinitis can give rise to darkness around the eye area. Okay, as the skin ages as well, you do find that the skin quality under the eye may deteriorate. So it may be more lax. You start to see more fine lines. And because of sun damage and pigmentation, you tend to see a darker area under the eye as well. So in a complete treatment for dark circles, we need to take into consideration those as well. So if you take a look at Yuki here, she also has started to develop a little bit of fine lines underneath the eyes, and that's because of loss of elasticity, and we will need to address that as well in our treatment other than putting in the filler. We also look at the eye as an entire aesthetic unit, and most of the time if we do treatments under the eye, we also tend to look above the eye as well, the upper lid area, to see whether we have any conditions that can be treated to give the patient an overall brightening and an energized look. Because most of the time patients who come to us for dark circles, they want to look less tired, and that's usually the aesthetic aim that we are trying to achieve that's beyond just treating the dark circle. So what kind of treatments would I recommend in, let's say, in a patient like this? Most of the time I think it's very important that before we put a needle into the patient's under eye area, we consider the mid-face as well. So in her case, if I were to put any filler in her face, it would usually be in the mid-face area, give a little bit of a lift here, and also replace a little bit of volume at the lid-cheek junction. So very often when we do that, there is already an improvement in the under eye area in terms of the dark circles. only then will I actually consider putting filler directly underneath the eye. Not all patients who ask us for dermal filler underneath the eye are actually good candidates for filler underneath the eye, and that's because there's usually a problem with skin quality as well, especially in the older patient. In this case, Yuki's skin quality is still decent. Okay, if in a patient with poor skin quality underneath the eye, if we were to put a dermal filler there, we can end up creating a few problems. Firstly, of course, there will be a lot of swelling in the area. Secondly, we can end up creating two sausages, or sort of like artificial eye bags for the patient, and that would be a disaster because they will actually look worse than before. Thirdly, we can also create this effect called the Tyndall effect, when there's a bluish discoloration underneath the eye as a result of filler. So in that particular group of patients, if they have poor skin quality underneath the eye, I would recommend treatments first to improve the skin quality underneath the eye, and there are a few options on the market. So we actually like to use lasers to improve the skin quality underneath the eye, and we use a combination of long pulse ND-YAG laser as well as a erbium YAG laser to kind of like resurface the skin underneath the area, giving it a more rejuvenated look and reducing the fine lines and wrinkles, and also improve the elasticity. In patients who cannot take the 2 to 3 day downtime of the laser, we also have less invasive methods of improving skin quality underneath the eye, such as HIFU or ultrasound, as well as radiofrequency treatments. Perhaps after treating the skin quality underneath the eye, the patient would become a better candidate for dermal filler later on. And there are also options of injectable treatments, for example, underneath the eye to improve the skin quality. And recently we have been using polynucleotide, which is a salmon DNA derivative. This can be injected directly underneath the eye. Okay, it doesn't cause any swelling and doesn't have any volumizing effect underneath the eye. Basically, what it does is to stimulate the body's inherent collagen production mechanisms, and it helps with hydration of the skin as well, so it gives the overall improvement of the skin even without doing a dermal filler. And it's also actually a very good treatment to do in combination with lasers to improve the overall skin quality underneath the eye. So I hope we answered most of the questions you may have on the treatment of dark circles. Every face is different, and we would like to perform a good assessment of you if you have any particular concerns. So hope to see you at Ensoul Medical Clinic. I'm Dr. Chiam. See you next week.